Why can traditional Chinese medicine TCM treat a wide range of ailments, from the common cold to cancer? It's a question that had 1,200 eager attendees flocking to the Santa Clara Convention Center on a sunny September 4th weekend. Among them were Huang Ziyun from San Diego and Li Yang from Los Angeles, all gathering early in the morning to catch a flight to attend the lecture by the renowned TCM practitioner, Dr. Ni Heisha, visiting the Bay Area. Dr. Ni Heisha, currently the dean of the Hantang School of Traditional Chinese Medicine, has been practicing TCM in the United States for over 2 decades since immigrating from Taiwan. He's been a tireless advocate for returning TCM to its ancient roots. In the Bay Area, many tech elites have sought his guidance in the ways of TCM. Even Professor Meng Huang, recently elected as an academician at the Taiwan Academia Sinica, and a lifelong Stanford University professor, counts Dr. Ni Heisha as his mentor in the world of TCM research. Dr. Ni Heisha's eloquence shone through as he discussed the dreaded topic of cancer, which sends shivers down the spines of many. From a TCM perspective, he explained that a woman's menstrual cycle is, in essence, related to breast milk. If the menstrual cycle doesn't eliminate all residues, leaving milk stasis in the breasts for an extended period, it can lead to breast problems. In contrast, Western medicine's mammography, with its breast compression, can inadvertently create blood clots, ironically increasing the risk of breast cancer. Dr. Ni Heisha used a simple analogy of a glass of water, some with added sugar, to illustrate the differences in the viewpoints of Western and Chinese medicine. Adding sugar to half a glass of water doubles its sweetness, which, from the TCM standpoint, means it's increasing the body's fluids and restoring the patient to a healthier state. Western medicine, on the other hand, might diagnose this as elevated blood sugar and prescribe medications to lower it. When it comes to diagnosing pancreatitis and pancreatic cancer, Dr. Ni Heisha highlighted the contrasting approaches. TCM can make assessments based on localized pain, sensations of cold and heat, night sweats, the flow of qi and blood during the 12 meridians, and pulse readings. Meanwhile, Western medicine necessitates invasive procedures, like inserting a tube through the throat and stomach to biopsy the pancreas. Patients often endure significant discomfort, followed by a hefty dose of painkillers, which come with their own set of side effects. Even after all this, when pancreatic cancer is confirmed, patients are often told it's difficult to treat. Dr. Ni Heisha summarized it as, Western medicine is highly technological but not necessarily scientific, while TCM may lack technology but is deeply rooted in science. For diseases that once wreaked havoc worldwide, such as SARS and H1N1 influenza, Dr. Ni Heisha wields ancient Chinese herbal formulas that have been in use for over 2 millennia. According to him, TCM's approach to treating these infections involves expelling the pathogenic factors from the body and restoring the patient's gastrointestinal health to prevent reinfection. In contrast, Western medicine relies primarily on influenza vaccines, which can be unreliable and contain excessive amounts of mercury, potentially leading to conditions like autism and hyperactivity in children. One audience member raised the question of whether alkaline water devices were necessary to maintain a healthy pH balance in the body. Dr. Ni Heisha shook his head, emphasizing that natural foods are the best way to promote well-being. To achieve a mildly alkaline state, all that's needed is to squeeze a quarter of a lemon into water and drink it after lunch. Despite its acidic taste, lemon is alkaline and is consumed after meals to protect the stomach. Since most people eat lunch, which tends to be a substantial meal, drinking lemon water afterward is gentle on the stomach. As for the troubling issue of dementia, which plagues many families, Dr. Ni Heisha pointed out that there's no mention of such cases in ancient texts that span thousands of years. Dementia is a modern affliction largely attributed to the excessive use of Western medications. Western drugs can harm the kidneys, And since the kidneys govern memory and bone health, this can result in conditions like dementia and osteoporosis.